It didn't involve too much more than just coming to clinic. Maybe I spent a little bit more time here, especially in the early days, doing a little bit more testing. They thoroughly tested my lungs, especially at the beginning. I was supposed to get a baseline of how my lungs were functioning, and then lots of blood testing and things like that, lots of consent forms to sign. But other than that, there was no major, invasive treatments or anything like that. The injection was the same, still turned up monthly. There was no extra time I had to spend here or anything like that. I had to wait around the first few times to make sure there was no interaction, but I'd have to done that anyway. Other than that, I didn't feel there was any problem being involved in a drug trial, and I would happily do it again anytime.
I now come once a month for my injection. I'm still on a course of steroids, permanent, but not like I was. I was on 15 milligrams per day. I'm now down to 9 milligrams per day and still gradually weaning off. I'm anywhere near the number of injections. Infections. But now, in the last 12 months, I think I've maybe had 3 chest infections. The weaning down of the steroids has gone from 15 milligrams down to 9. Everything's moving in a positive direction.
I think it's fair to say that I had my doubts about whether it would be successful. The nurses were lovely. A very, very professional unit. It helped that the facility was fantastic. But right from the off, I realised that everyone was invested in making me feel better. I had to stay a couple of hours after having the drug. I remember suffering with a bit of back pain, and I had some doubts about whether it would be successful. It was only about 48 hours later did I realise I've not had to take my inhalers. It was almost an overnight change.
The first trial was actually a trial on how people use the inhalers. And so I came along and I was trained in what they wanted me to do. And then I went home and did it like a good boy. And it did improve things. I mean, for me, the system that they were promoting here actually works better than just taking the inhalers as they're prescribed. And then I went on, I've done other trials from there. I've done drug trials and I've done all sorts of strange things. I pretty much had every test that you can actually give to an asthmatic.
And I knew that I was on the 8-week trial. I knew, even though I come every 4 weeks, I had my injection, but every other month I knew from how I felt. I got really bad joint aches, a terrific headache, and it used to come on about 7 o'clock every night. And I used to go and take painkillers, go in the bath. So I knew, but it was about 2 years before I found out I was on that. But I knew from the way the drugs make you feel. It is quite time consuming, but the benefits are marvellous, and I would have paid for the drug.